The outbreak of COVID-19 has been declared a public health emergency of international concern, and the virus has now spread to many countries and territories. While a lot is still unknown about the virus that causes COVID-19, we do know that it is transmitted through direct contact with respiratory droplets of an infected person, generated through coughing and sneezing. Individuals can also be infected from touching surfaces contaminated with the virus and touching their face. Examples are eyes, nose, and mouth. While COVID-19 continues to spread, it is important that communities take action to prevent further transmission, reduce the impacts of the outbreak, and support control measures.
Children and young people should understand basic, age-appropriate information about coronavirus disease, including its symptoms, complications, how it's transmitted, and how to prevent transmission. Stay informed about COVID-19 through reputable sources such as UNICEF, WHO, and National Health Ministry advisories. Be aware of fake information, myths that can circulate by words of mouth or online.
In a situation like this, it is normal to feel sad, worried, confused, scared, or angry. Know that you are not alone and talk to someone you trust, like your parent or teacher, so that you can help keep yourself and your school safe and healthy. Ask questions, educate yourself, and get information from reliable sources.
2. Protect yourself and others, or wash your hands frequently, always with soap and water for at least 20 seconds. Remember to not touch your face and do not share cups, eating utensils, food, or drinks with others.
Number 3. Be a leader in keeping yourself, your school, family, and community healthy. Share what you learn about preventing disease with your family and friends, especially with younger children. Model good practices such as sneezing or coughing into your elbow and washing your hands, especially for younger family members.
Number 4. Don't stigmatize your peers or tease anyone about being sick. Remember that the virus does not follow geographical boundaries, ethnicities, age or ability, or gender.
Number 5. Tell your parents, another family member, or a caregiver if you feel sick and ask to stay home.
6. If you are going out, we must avoid places with crowded people and practice safe distancing.
7. If going out, we must wear a mask. The CDC and WHO recommend wearing cloth face masks in public places where it's difficult to avoid close contact with others, and schools are no exception. This is based on data showing that people with COVID-19 can transmit the virus before realizing that they have it.
Number 9. Keep hands clean. Practice hand washing at home, especially before and after eating, coughing or sneezing, or adjusting a face mask. To prevent rushing, suggest washing hands for as long as it takes to sing the happy birthday song twice. When hand washing isn't available, suggest that you use an alcohol-based hand sanitizer that contains at least 60% alcohol.
There are many ways to prevent spreading COVID-19. As a child, student, worker, employee, medical frontliner, whatever your job is or what is your state, you can prevent spreading the virus. Just remember these steps and follow the protocols. Meal planning. Meal planning helps you and your family be prepared, which is especially important right now. By planning your meals and snack, you can save money, reduce food waste, and limit trips to the grocery store.
Eating a healthy diet is very important during the COVID-19 pandemic. What we eat and drink can affect our body's ability to prevent, fight, and recover from infections.
Eat a variety of food including fruits and vegetables. Choose whole grain food like unprocessed maize, millet, oats, wheat, and brown rice when you can. They are rich in valuable fiber and can help you feel full for longer. For snacks, choose raw vegetables, fresh fruits, and unsalted nuts.
Eating breakfast will help you start your day with plenty of energy. Don't ruin your breakfast with high fat and high calorie foods. Choose some protein and fiber for your breakfast. Breakfast is also a good time to eat some fresh fruit.
In a week, you can have at least 2 times of having omelette, sunny side up, boiled or whatever kind of cooking egg in your breakfast paired up with fresh milk and bread. For sure, it will be a great combo with nutritions on it.
For lunch, you can have 1 bowl of chicken adobo in your meal and pair it with 1 cup of rice, or you can have extra rice if you want to.
Chicken adobo is a great food to eat as it contains a large amount of protein with fats and carbs making up a small portion of its calories. This allows for more flexibility in your diet, which translates to better results and tremendous health benefits.
Dinner is a time when it's easy to overeat, especially if you haven't eaten much during the day. So watch your portion sizes. Mentally divide your plate into 4 quarters. 1 quarter is for your meat or protein source. 1 quarter is for a starch, and the last 2 quarters are for green and colorful vegetable or a green salad.
Feel free to add more water, coffee, or herbal tea to anything, but keep in mind that adding cream or sugar also add calories. It's okay to swap out similar menu items, but keep cooking methods in mind. It's also okay to eat snack a day. Just be sure to buy food snack from trusted brands and that it contains nutritious facts.
How do we choose what, when, and how much to eat? Of course, we need the energy and nutrients present in the food to allow us to live, and this idea of energy balance is familiar. We use a varying number of calories each day and need to replace them. But it is certain that we don't only eat because we're hungry. Imagine that eating was driven only by energy balance, homeostatic mechanisms, that we only ate the calories and nutrients that we needed. If that were the case, then neither obesity nor conditions featuring low body weight would exist.
The food environment has a huge influence on food choice. Choices can only be made where they exist, and in the developed world at least, we are lucky to live in a food environment where calories and nutrients are abundant, safe to eat, and inexpensive.